Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Before we turn to this episode, the whole team at Public Health on Call wants to acknowledge our undergraduate intern, Caroline Wong, for the fantastic support she provides to our social media presence and so much more. Thanks, Caroline. Today, Colleen Berry, Chair of the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health, talks with Stephen Patrick, a pediatrician and faculty member with the Center for Child Health Policy at Vanderbilt School of Medicine. Dr. Patrick is the lead author of a new study on the well-being of children and their parents during the COVID pandemic. They discuss the worsening mental health of parents and children in the context of COVID, the uncertainty surrounding K-12 school reopening, and policies that should be advanced to better support families in this difficult time. Let's listen.
Stephen Patrick, thank you so much for joining me today. You are the lead author of a new study published in the Journal of Pediatrics showing that COVID-19 has caused major disruption in the lives of children and parents. Can you share a little bit about the study and its findings?
Well, first, Colleen, thanks for having me today. In early June, we fielded a nationally representative survey of parents to better understand how COVID-19 and physical distancing measures that were enacted to mitigate its effect have had an effect on families. We asked a range of questions from parental mental health, child behavioral health, food security, insurance changes, caregiver disruptions, and childcare. It's a lot of questions, but the results were pretty striking. Families are in distress at almost every level: mental health, behavioral health in kids. Kids are less food secure, have disruptions in insurance, childcare, and healthcare. But until we start talking about schools, kids have largely not been part of the conversation. And we hope these data will inform both the public and policymakers as they consider ways that they can help support families and schools in a more targeted way in the next few months.
So let me dig into the results from your survey a little bit. You found that 27% of parents reported worsening mental health for themselves, and 14% reported worsening behavioral health for their kids. And it sounds like maybe for both parents and children, the mental health effects have hit perhaps even harder than the physical health effects of the pandemic. Is that right? And were you surprised by that?
Yes, you're right. I mean, we found that worsening mental health for parents and behavioral health for children were more common than worsening physical health. And as a parent, I kind of get it. This has been hard. Not only have we taken on additional roles, but we also have no break. Our children are around constantly. They don't have a break from us. We don't have a break from them. We're teaching. For my kids, for us, it's been hard. But the data tell us something deeper too. I have a great job. I don't have to worry about losing my job or my kids going hungry. And so much of the distress that we've found appears to be at least associated with some of these stressors. We've seen the largest loss in jobs since the Great Depression. And if we dig a little bit deeper into some of the data, we found that about 1 in 10 families that had in the United States had worsening parental mental health and child behavioral health. And these families also had larger disruptions of everything else. For example, in those families, half delayed medical care, nearly half lost regular child care. 1 in 6 had a change in health insurance, and 1 in 10 had worse food security. So is it any wonder why parents are in distress? With all of our privilege, this has been really challenging for us. But I can't even imagine going through a job loss, my kids being hungry. That's distressing.
So let's dive into each of those threads that you looked at with your survey. So it sounds like you found that a quarter of parents surveyed reported a loss of regular child care. And these numbers were even higher for parents of very young children. So the pandemic has really been, it sounds like, devastating from a childcare perspective. Are there safe ways to find some alleviation of this for families to begin to get childcare supports back in their lives? As a pediatrician, what do you recommend to families?
The question of childcare is so essential to next steps as we think about the pandemic. And I think I would turn the question slightly to say, what do we need to do to make childcare safe and sustainable for families? Arguably, we've had a childcare crisis in the US for a long time. COVID-19 has really just exposed and elevated many of the problems that we see for children and for families. We need a better fund childcare, and we need a more sustainable investment into early childhood education programs. One of the things that's really important is that Congress is currently considering multiple ways to bolster childcare in the US. About half of childcare workers, institutions stayed open during the crisis to serve essential workers. But many closed, had big drops in enrollment, and had additional stressors of implementing protective measures. There's a recent estimate that found that about 4.5 million childcare slots could be lost forever because of COVID-19. And look, I think this is a time where we need to think about what's happening. How can we sustain childcare in the United States? How can we be innovative to think about how we can expand it? Things like universal pre-K, Head Start. We need to think more holistically about how we do this. To your question is, what do we do right now? I think we need to get resources out to childcare facilities now so that for essential workers, for folks as they go back to work, they can feel somewhat reassured that protective measures are being taken.
So let's connect this to specific populations that may have struggled even more than folks in general. It looks like in your survey results among parents, the largest declines in mental health were reported by women and unmarried parents. How might we interpret those findings, and how does the comment that you just made about policy responses related to childcare connect to that?
Yeah, it's also among families with younger children too. Imagine how hard it is just at baseline to be a single mother with a young child before the pandemic, and then throw in job loss and childcare loss. It's a perfect storm. And, in my day job as a neonatologist, I see single moms in the unit all the time, in the neonatal intensive care unit. And the struggles they face in terms of social support, sometimes it just feels very heavy. You're right that I think we need to think through some of these supports. Childcare, early childhood education programs, things like specifically like early Head Start, they are not only important for child development, but they're also a way for moms to get and young families to get resources so that they can go to work and thrive. This is just an important inflection point as we think about where we're heading as a society, how we can provide those stable and important early educational resources for families so that their children can develop optimally and so that they can remain employed.
So another part of the social safety net that has been strained in the context of COVID relates to hunger and family food insecurity. Can you talk a little bit about what we know about hunger in children right now? And also, what does job loss mean for families' ability to access health insurance?
I have to tell you that the most visceral part of what we uncovered were changes in food security. And, for all of us as parents, just thinking through what that means for a child to go hungry at night. We found that 8% of families after the pandemic were either moderately or severely food insecure. And that means that often or sometimes they couldn't afford to buy food. That should be a gut punch in 2020 in the United States. And look, our paper is echoing what's happening in other papers that are being published right now. Sometimes the effect size is different, but every time we're seeing almost everything saying food security is getting worse for kids. And one of the things that happened is that parents lost jobs. They are less financially secure. And then millions of kids receive food from schools too. And they lost that immediate access. There's some important waivers that have happened during this time where families can pick up food at schools. Some of those programs, it's uncertain if they're going to continue. There's another program called the Pandemic EBT program that allowed for kids who receive free or reduced lunch, to get a card essentially to pay for food. But we know some of those programs, and this is being somewhat generous, have had challenges in being implemented by states, including in my own state in Tennessee. What we found from our work is that only about a quarter of eligible families were enrolled. This really should be a national call. We should be talking about how we can make sure kids are fed. That is really at the most basic core of what we're doing. I mean, Congress is talking about it now. And again, I keep on going back to Congress because I think this is such a key time when we're talking about various packages for how we can support families during COVID-19. We've got to remember kids. We've got to remember families. We're talking about schools now, but in many ways, we aren't having the right conversation about schools. We're talking about, holding back funds from schools if they don't completely open. That's the wrong conversation. The conversation should be about kids' needs. The other question you asked was about employer-sponsored insurance and employment. We have an employer-sponsored insurance program in the United States. So when families lose their job, they lose their insurance. And we found that about a 3 percentage point decrease in employer-sponsored insurance. And look, there are long-term issues to talk about this and the sustainability of employer-sponsored insurance. But one of the things that it highlights for me, again, is how are we going to respond now to this? Can we do things to help families when they've had these insurance disruptions? Things like COBRA subsidies that may help families maintain their employer-sponsored coverage. How can we help build up state Medicaid programs too? One of the challenges that Medicaid has in the way that it is financed, it's a joint federal and state run program, but it's financed based upon a formula that it's a 3-year moving average based upon the income in the state, the per capita income in the state. And because of that, it doesn't respond very quickly when we have big downturns like this, that matching rate, the amount of money that states get to fund their Medicaid program. Congress began to address this early in the pandemic, but states are really struggling, and many states, they have to have a balanced budget. This is also a call, I think, for Congress to support state Medicaid programs with enhanced federal match moving forward too.
That's really helpful. Okay, let's just go even deeper into this K through 12 schooling question. So it's crunch time for schools and parents to figure out what fall is going to look like. And in some areas, kids have already returned to school. And as we have just been discussing, school is critical, not just for learning, but for social and emotional well-being. And as you've said, to protect against hunger. So I think it's not an exaggeration to say that families of school-age children, school administrators, and teachers are facing truly impossible situation right now. From a parent perspective, what are the most important factors to consider?
I could just tell you from a personal note how I engaged in a conversation with my kids about this. We are living in uncertain times, and in many cases, there haven't been really clear guidelines about this. In my family, we had a conversation with our kids. Our school district, at least initially in the planning phase, was offering kids to stay completely at home, or if the virus prevalence was at a certain place, go in person with appropriate physical distancing measures. And so I think it's important to have an age-appropriate conversation with your kids, talk about what they want, what they need. Some of this from a parent perspective is really about figuring out what your kids need. For some kids, their need to be in some of these social groups may not weigh in as much as the concern about the virus, particularly for kids with chronic medical conditions. So some of this does really need to be personalized to what you do. I do think there's a broader conversation though here too. And look, the quickest way for us to return to normal is to start taking the virus seriously. And we just aren't throughout the United States, and including in my state. Just to get out of the house last night, my family and I drove around. We drove through downtown Nashville, and Broadway is where all the honky tonks are. And we just drove down there to see what it looked like. And what we saw was disturbing to me. We saw bars open and a bunch of people without masks. And even though there's a mandate in the county for masks, multiple people, they weren't enforcing it, clearly. So the quickest way for us to get back to schools is to prioritize schools, to take things seriously. If the community really wants us to get back to normal, we need to wear masks, we need to physically distance, we need to do the hard work so that we can get back to normal.
So In some areas, we do know that school is going to be all virtual. So some school districts and schools have made that call already. And the movement is in that direction in a lot of parts of the country. Do you have recommendations for parents to support their kids' mental health if school is virtual for them?
So I think this is going to take an all hands on deck approach a bit. I think schools are going to have to approach this differently too. How can we enhance the training we give to both teachers as well as school counselors? In many schools, it's also a place where students can access mental health resources. How can we be creative in the way we do that, including virtually? I think this is a time where parents should be talking to their pediatricians too. Pediatricians are a good place where you can begin to consider talking about how your child's doing with this. I mean, we have conversations with our kids' pediatrician about this, even as a pediatrician, right? These are challenging times. This is going to take, there's not a one size fits all approach. It's going to be, and I've heard some folks say this isn't, I'm in the South, right? There's not a silver bullet. There may be silver bookshot. There are multiple ways to attack this. So I think it has to be part of leveraging your own local community, whatever that looks like. Maybe your neighborhood and a small pod of kids where you get kids interacting, riding bikes outside. It may be your pediatrician. And I do think this is a time where we need to support schools to really leverage their expertise in this too, and provide them the resources necessary.
So this past spring, when we were all sheltering in place, I worried a lot about children not being under the eyes of teachers and other school personnel who have mandatory reporting obligations when they spot potential child abuse or neglect. Are there steps we can take from a policy perspective or a community perspective to protect the most vulnerable children if schooling is virtual?
I think this one's challenging. I think, we've heard anecdotal reports that, in our state, the child welfare reports are down. We know from existing literature that in times of stress, even to the detail of having changes in food security programs, that child abuse goes up. And yet we aren't seeing these kids present either to pediatricians, as we found in our work, or to schools. So I think this goes back to some of the training that we need to really emphasize. I mean, look, teachers are the first line for this. Pediatricians are the first line for this. I think as professionals in this space, we need to kind of keep our sense up that this is happening. I also think that just in our communities, keeping an eye out, but that's really challenging. We are all more distanced. I think schools, as they start back virtually, as we think about training, if we think about this unique space, a focus in on mental health of parents, behavioral health of kids, an eye on what special circumstances kids might be facing, including abuse, neglect, hunger. These things are playing out. And I think it's a slight frame more than schools already do. And the other thing here is we also need to take care of our folks who are working in schools and their mental health, because we found that more than a quarter of parents had worsening mental health. Those are people working in our schools, and they are living through their own trauma as well as the trauma that kids are going through. And so we need to be mindful of bolstering ourselves too.
Stephen, this is my last question. This is such a difficult time. I think all of us are trying to look for silver linings in this period we're all experiencing. From your perspective as a pediatrician and as an expert in child health, do you have a silver lining for me?
I mean, as a pediatrician, I'm an eternal optimist. I think that when we find cracks in systems like this, we start to address them in ways that are unique. I see conversations happening in Congress, not to the level that I would like them to be, that are talking about food security. We're talking about childcare. In some ways, some of the funding for childcare dwarfs what we've talked about in the past. We are leveraging technologies like telehealth like never before that may, for example, help us expand mental health access to kids nationwide in rural communities and urban communities. I think there's really positive things that can come out of this. I think we need to react now to understand the needs of families, but we also need to learn about some of the positive steps that we've made so that we can keep them going and we can keep on persisting and we can serve families better.
Those are great silver linings. Thank you, Stephen, so much for joining me today.
It's been a pleasure to talk to you today.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.